Harm reduction services is made up of specialist nurses. There's myself and 3.4 full-time equivalents band 6 nurses. We work across the area to try to engage individuals to test them for bloodborne viruses, to help give them advice, information, deliver wound care, any services which are prevalent for their needs. And for me, that's exactly what harm reduction is. So the provision of naloxone is also very important to this population, because we have, in Scotland there was 1,172 deaths last year. Of them, 80% were using opiates, was one of the drugs of distinction that were found in post-mortem. So naloxone training is something which we deliver to all individuals who come in for injecting equipment. We want to make sure that everyone who has the mechanism to overdose has the mechanism for reversing that overdose as well. So it's all about the engagement. We need an opportunity to engage people, and that may be done in the acute sector as well, in hospital settings, and the hospital liaison service, which we had previously, would be a good opportunity to do so. So harm reduction is funded through public health, and they coordinate services both in the NHS as well as the private sector. We have Positive Steps, we have Help Us Futures, we have We Are With You. We're all three fantastic third sector organisations who work specifically with people who use drugs.
We are a charity that has been supporting NHS for the past over 10 years to provide an enhanced IEP, which is the injecting equipment provision across Tayside. We work in partnership with our NHS colleagues, our specialist harm reduction nurses, providing dry blood spot testing, naloxone, which can support people that have had a recent non-fatal overdose and will temporarily reverse effects of an opiate-based overdose. As well as this, we support people to access recovery activities. We host recovery cafes, wellbeing drop-ins, activities and groups, peer education, and lived experience is embedded through the organisation from a grassroots level. We want people to come in at a voluntary entry level, gain qualifications, knowledge, skills, and go on to hopefully gaining employment, and again going on to maybe a positive destination within the community.
I came from like 38-year substance misuse and alcohol misuse. When I was about 7, 8 months sober, clean, I come over to having out of the caring centre it was at the time. Got a job as a wee volunteer job in the cafe, and then it was the rollout of the naloxone. So I ended up getting a sessional job doing that and working in the needle exchange and working with the naloxone until the naloxone was rolled out, and then I got a full-time contract with Hillcrest. It's mainly going about the hostels and drop-ins and stuff like that. Just seeing if anybody what support people are needing, and if I can do it, I'll do it. If I can't, I'll signpost them or refer them on. And I take an IEP bag with me, so I've always got clean injecting equipment with me in the naloxone. Giving back my time to other people was helping me in my recovery, and seeing if they're progressing, and that was also. Plus, it was giving me stuff to do. I never had anything to do before. I had never had any hobbies or anything like that, because all my time was spent in addiction, you know what I mean? So I've kind of made my life's run about my work now. Everybody knows me for doing the naloxone and that.
We work truly whole system in harm reduction and hepatitis, and that's across all of NHS Tayside with all our partners in the health and social care partnerships. We also work across community pharmacies, the laboratories, and the University of Dundee. Our links with academia have been essential to this work as well, and these partnerships are essential as we go forward in tackling drug-related deaths and non-fatal overdose. Critically for us, our clinical teams that we've always worked with, they absolutely understand the necessity in prevention, and they've always supported us in investing to save, and that has been absolutely essential in this work. And we look forward to applying the techniques that we've used around hepatitis C into other areas as we move forward, such as looking to eliminate new transmissions of HIV.
The partnerships my colleagues have described over the last few minutes were developed to help us try and eliminate hepatitis C, which we've achieved in NHS Tayside, one of the first places in the world, back in 2020, at the tail end of COVID. That achievement was due to those partnerships by moving care out into the communities and working with our partners who had relationships with the people that most needed treatment. I think that's a really excellent example of, thinking innovatively and investing to save. And so by treating hepatitis C early in a way that people said was impossible, using these partnerships has allowed us to treat early, prevent infections and save the need to treat patients in the long term. The unintended consequences of that have been that drug-related death amongst those people that with hepatitis C who have engaged in therapy have been reduced by a factor of 5. And so thinking about that holistic care approach to deliver to this group of people who are traditionally described as unreachable and unable to make contact with health services, we've demonstrated you can do that and achieve huge benefits.
So we've had great success in Tayside looking at the hepatitis C story and what we've achieved, but there's so much more from harm reduction that we need to do. So we can build on the successes we've already had. We can go further. We need to look at drug-related deaths and how we can engage that population in a better way in order to reduce those numbers. We need to be able to make sure that collectively we work together to enable a better service we deliver to people who use drugs.